Hello, I'm Jerónimo Farré. In this video, Professor Wellens and myself will explain you why non-evident ventricular preexcitation can be important. This electrocardiogram is from a 20-year-old male with a history of recurrent palpitations that were triggered during exercise, usually playing football or running. The episodes last usually for 2 to 5 minutes and are accompanied by chest pain. The episodes terminate abruptly, sometimes with coughing or withholding the respiration. The question is the following: what do you think is the problem of this patient? Do you think this patient may suffer AVRT due to a concealed accessory pathway, or AV nodal reentry tachycardia, or an atrial tachycardia, or a WPW syndrome, or a short QT syndrome? This electrocardiogram was discussed during an interactive voting session at an European arrhythmia meeting a few years ago. The reply to our question was the following: the great majority, 46%, thought that we were dealing with an atrioventricular reentry tachycardia using a concealed accessory pathway. The second group in frequency were those people that said that this was a short QT syndrome, for reasons that I still don't understand. AV nodal tachycardia was the reply of 10% of the people attending the meeting, and 9% replied that that could be an atrial tachycardia. The arrhythmia, that obviously we hadn't shown the arrhythmia to the audience, but they could suspect atrial tachycardia, and only 8% said that this patient could have a WPW syndrome. Here you see the 12-lead ECG during sinus rhythm in this patient, and also an enlarged view of leads 1, 2, and 3 during sinus rhythm as well. Note that the PR interval is 130 milliseconds and that the QRS complex has a duration of 90 milliseconds. There is not a clearly discernible delta wave in this electrocardiogram. If this case would represent an example of non-evident preexcitation due to a left-sided accessory pathway, do you think that the risk for developing life-threatening ventricular rates should atrial fibrillation supervene in this patient would be low? And we offer you 3 possible answers: yes, no, or we can tell from this electrocardiogram. The replies we obtained to these questions were: yes, 71%, no, 6%, and 23% said that we couldn't tell from this electrocardiogram. So the question here is why the great majority, 71%, thought that non-evident pre-excitation, if present, would be a marker for a low risk of developing fast, life-threatening ventricular rates due to atrioventricular conduction over the accessory pathway if atrial fibrillation develops. Why? We understand this answer because some people think that when ventricular preexcitation is not easily appreciated in patients with accessory pathways capable of anterograde conduction, they represent a low-risk case. We must disagree with this statement, as our case will prove. In this slide, panel A shows the electrocardiogram during sinus rhythm in this patient. Panels B and C display the arrhythmias that were induced during the electrophysiologic study in this patient. Panel B shows the AVRT using a left-sided accessory pathway as retrograde limb of the reentry pathway. And panel C illustrates atrial fibrillation. Panel D is just a detailed view of panel C, showing leads 1, 2, and 3 to illustrate that during atrial fibrillation the ventricular rates were very fast and that this pre-excited atrial fibrillation had a shortest pre-excited RR interval of 180 milliseconds. This case shows that non-evident pre-excitation doesn't mean a low risk for developing life-threatening ventricular rates if atrial fibrillation develops. We want to finish emphasizing that non-evident pre-excitation is a matter of conduction times. Having atrioventricular conduction times via the accessory pathway that are equal to or greater than 120 milliseconds in patients whose atrioventricular conduction times via the AV node His pathway are equal to or lower than the atrioventricular conduction times via the accessory pathway. However, developing high life-threatening ventricular rates during atrial fibrillation is related to the anterograde refractory period of the accessory pathway. Patients with non-evident pre-excitation do not represent a low-risk group if the refractory period in the anterograde direction of the accessory pathway is short. Thank you very much for your attention. Watch Ventricular Pre-excitation Part 6.